The KRISTINE study really looked to explore if T-DM1 and pertuzumab would be as good as the TCHP regimen. And so in this trial, patients were randomized to receive 6 cycles of TCHP or to receive 6 cycles of T-DM1 and pertuzumab and then go to surgery. And at the time of surgery, we did see that TCHP was superior to T-DM1 and pertuzumab, where there was a higher rates of pathologic complete response in patients getting TCHP relative to T-DM1 and pertuzumab. However, I think important to note there was less toxicity in the T-DM1 and pertuzumab arm. But then interestingly, the study also followed patients after surgery. So those patients on TCHP went on to continue on to trastuzumab and pertuzumab, whereas patients who got T-DM1P continued on their treatment. And then they looked at long-term outcomes. And one interesting thing that was seen was that there were more patients in the T-DM1 and pertuzumab arm who experienced local regional recurrences prior to going to surgery. And interesting, when you dug down into those patients who experienced local regional recurrence, you can see that about 2/3 of those patients actually had HER2 2+ tumors. And so suggesting that those patients with HER2 heterogeneity are those patients who are experiencing local regional progression on T-DM1 and pertuzumab, which certainly probably contributed to the differences that we were seeing, at least in terms of pathologic complete response rates between the two arms. But then when you actually follow those patients long-term and look at invasive disease-free survival, you actually saw that the invasive disease-free survival was similar in the two arms, with the curves overlapping. So event-free survival was certainly better with TCHP compared to T-DM1P, but the invasive disease-free survival was actually quite similar. And so what this really tells me is that potentially in a patient who did not have a heterogeneous HER2 positive tumor, that those patients may do just as well with T-DM1 and pertuzumab with long-term outcomes as they would do with TCHP. And I think this is quite important because T-DM1 and pertuzumab is so much better tolerated than TCHP. So if we could identify those patients who do not have HER2 heterogeneity, potentially these are the patients who could omit standard chemotherapy and do just as well with T-DM1 and pertuzumab. There was also the PREDIX trial, which had compared THP, so docetaxel, trastuzumab, and pertuzumab, to T-DM1, and actually found very similar rates of pathologic complete response, 45 and 47% in each arm, really again suggesting that T-DM1 performs quite similarly to chemotherapy and trastuzumab and pertuzumab. Certainly, the THP regimen is probably not quite as good as the TCHP regimen that was looked at in the KRISTINE trial, where we did see a higher pathologic complete response with that regimen compared to T-DM1. But I think this study, again, just suggests that T-DM1 based therapy can be very effective even in early HER2 positive disease. And we really need to move forward trying to best select those patients who don't have heterogeneous HER2 positivity, because again, I think those patients potentially may be able to de-escalate from a standard chemotherapy regimen to T-DM1 in the future.